Assalamualaikum doctor. In this video I am discussing about arthrogryphosis. So arthrogryphosis, that is a congenital joint contractures in two or more areas of the body. So look at this image, that is contracture of the joint, lower limb how deformed, how present, upper limb how present. So arthrogryphosis in musculoskeletal clinical examination it comes. It is a congenital joint contracture in two or more areas of the body. Causes and type. Number 1, arthrogryphosis multiplex congenita, AMC contracture. Okay, a very typical position soon after birth, symmetrical and involves all four limbs. Faces are normal, intelligence is unaffected, short stature, featured in later life. So their face is normal but four limb look like this picture. Then causes are extrinsic and intrinsic. Extrinsic are fetal crowding due to oligohydramnios, sometimes related to Potter syndrome with renal agenesis and pulmonary hypoplasia, multiple pregnancy and poor intrauterine mobility. So oligohydramnios is very important due to oligohydramnios because related to Potter syndrome with renal agenesis and pulmonary hypoplasia, multiple pregnancy, poor intrauterine mobility. Now intrinsic is neurological, anencephaly, neural tube defects, anterior horn cell defects, muscular congenital myopathy, myotonic dystrophy, myasthenia gravis, skeletal synostosis, prenatal joint fixations. So these are the causes of arthrogryphosis. Distal arthrogryphosis syndrome. It is an autosomal dominant disorder type 1, hands and feet predominantly affected, overlapping fingers, ulnar deviations, flexion contracture of the fingers and foot deformity. So this deformity we understand that overlapping the fingers, like our pictures, overlapping the fingers, ulnar deviations also, flexion contractures of the finger, that is look like the picture, and foot deformities like our pictures. Syndromic causes trisomy 18, certain mitochondrial disease, spondyloepiphyseal and dystrophic dysplasia. What are the investigation we do? Diagnostics clinically, lab we are doing EMG, CPK, creatine phosphokinase, electromyography, muscle biopsy, renal function test due to oligohydramnios, lactate and genetic testing. Good. Imaging we do X-ray of the spine if scoliosis, spirometry, MRI of the brain and spine if involved, hearing test. Multidisciplinary team we are involving physiotherapy, orthopedic surgeon, splinting, psychosocial and occupational therapy and genetics neurology. Prognosis, if not syndromic, can be treated by surgery and so lead a normal quality of life. Ask the mother about any problem during pregnancy, fetal movement and amount of the fluid around the baby. So after examination, I would like to complete examinations by asking the mother about the any amount of fluid during amount of fluid, that is oligohydramnios present during pregnancy, or any about birth process. We want to know any fetal movements during pregnancy, any problem during pregnancy mainly. How can we present the case? Today I examine Ali. Ali is a 8-year-old boy. He is well communicating, he is well looking, not in pain or any distress. He is small for age or short in stature, though I want to plot on appropriate growth chart. Then I find there is maybe scar may be present, then a scar I find there may be any no abnormal movement, but there is any supporting aids, walking device, anything presents. And on examination what I find he has today I do his musculoskeletal examinations. I find his limb deformity, that is hand deformity and leg deformity. Hand or fingers are overlapping, legs are deformed legs, that is flexion and contracture present on the legs mainly. Four limbs are affected. So putting together, it is a case of arthrogryphosis multiplex congenital contracture. Thank you.